Hello. So I am going to be doing postpartum instructions. I'm still trying very hard to get caught back up from being out of school for a little bit. Anyways, I usually am the one that does the postpartum instructions anyways at work. Sometimes we do like a combination. So I have my reference here too, so I'm going to try not to read it too much because normally I just kind of go in and sit down and make sure that the baby's nursing well and things like that, and go over stuff. So for the mom, some of the most important things I try to instill is that you should be resting, you should be nursing your baby, or bottle feeding your baby, whichever, but typically most of our moms at least start out nursing, and nourishing your body with food and plenty to drink. We encourage you to continue taking your prenatal vitamin and placenta encapsulation if you choose to do that. If constipation's ever been an issue during your pregnancy or anything like that, then I like to encourage the Calm magnesium drink, or if you want to, you can just take a stool softener, because we definitely don't want you to get constipated after giving birth. If you had stitches, they will dissolve. We give a Epsom salt herbal soak with every client, so we encourage you to try to take several baths a day if you're able to. If not, just like a sitz bath, and just set your bottom into the water and warm water, and that can help with healing and cleanliness, obviously, and then also it'll help the stitches dissolve. So all of those are good ways to help with perineal healing. It's okay to use, there's several different sprays on the market now that a lot of different companies make now. Frida Baby makes one. Mother Earth Baby, I think is the name of it, makes another herbal spray, perineal spray. Witch hazel pads, dermaplast, any of that stuff is okay to use also, or ice packs, but none of them are really necessary. You just need to do some soaks in the tub, and that's sufficient. When you go to the bathroom, just use the peri bottle to clean yourself with. And especially if you have some, like what we call skid marks, those are tears that are not necessarily going to need stitches, but they can burn when you urinate. So it's nice to use a warm peri bottle as you're urinating, and that can help with lessen the burn. The postpartum bleeding is going to continue for several days to weeks after giving birth. And the more you do, the more you bleed. So we really encourage you to relax, rest, try to get as much sleep as possible. It's very hard with a newborn, but the more you're up and about, the more you're going to bleed. You have to consider the fact that you have like an 8-inch wound inside of your body. It's like the size of a dinner plate. And, anyone who had a wound that size on the outside of their body would be encouraged to rest. But just because we don't see the wound, I think it makes, maybe mom guilt, or makes you more likely to get up and try to start doing things before you should. And that's going to increase bleeding. And so you may pass some dark clots. Those are okay. They shouldn't be bigger than like a golf ball egg size. You may pass one that's a little bigger than that, but if it's dark, that's okay. It means it's been sitting in the lower segment and it just needs to come out. If they're bright red clots, those are a little bit more worrisome. Put baby to breast, massage the fundus. That's the top of your uterus, which will show you what it should feel like and what it shouldn't. It shouldn't feel spongy. It should feel hard, kind of like a softball. And another indication that you may be bleeding too much is if you're soaking a pad an hour, that's a little bit too much. This is another situation where you want to take the top of your hand and push down on the fundus, and you should be able to massage vigorously until the uterus firms up into a ball. So if it's soft whenever you start doing that, or if you can have a partner do it, You massage and massage and massage until it should firm up like a kind of like a softball or a grapefruit. And put baby to breast. If you latch baby on, that will cause contractions and that will cause the uterus to firm. The firming of the uterus is what controls the bleeding. There's where the wound is, there is blood vessels that are open, and when you contract and the uterus shrinks down and involutes, that's what causes the bleeding to be under control. Also, if you feel like you're bleeding too much, go to the bathroom and try to empty your bladder. That can be another thing that causes bleeding. So we really want you to frequently urinate. The after pains after birth, those are still contractions. Those intensify when you're nursing. The oxytocin releases, and that's what intensifies the after pains. That helps your uterus cramp down. That helps your bleeding get under control. If those become pretty painful, also try to urinate. And then if it's still too painful, you can take up to 800 milligrams of ibuprofen every 8 hours as needed. It's best to let your nipples air dry. If they become cracked or sore, you can express a little bit of breast milk and put on them and then let them air dry. There's also different creams and things like that you can use. Lanolin's one that you do not have to wipe off before the baby nurses. Just make sure you read those and make sure that they're okay to not wipe off. If your breasts become, hot or streaked, or if you develop a fever, that could be an indication that you have mastitis. So just definitely give us a call. That's a breast infection. The next few weeks, next several days to weeks can be overwhelming emotionally. You have this surge of hormones toward the end of the pregnancy and in the birth, and then those really take a dive after birth and can cause sadness and tears. It can just feel really overwhelming. The number one thing that can help with this is rest. So the more rest that you can get, the better. If that does intensify though, to the point where you feel like you're in despair or you just can't manage, definitely give us a call. The major things that you're looking for yourself are a temperature over 100.4, a resting heart rate over 100 beats per minute. So that means you're just sitting down and your heart rate shoots up. A soft uterus, if you take your hand and you feel like you rub down until you feel, and you do not feel that firm uterus. And soaking more than a pad an hour, persistent large bright red clots, fainting, severe persistent headache, severe abdomen pain, leg or chest pain, and then extreme feelings of despair, anxiety, things like that. Those are definitely some risk factors that you should give us a call. If it's emergent and you do not feel like you can cope, you can definitely call 911. So for the baby, the baby's main things are they need to stay warm, they need to be fed frequently, and frequent diaper changes. Keeping the baby warm is paramount. That can cause a whole host of issues. Their blood sugar can drop. They can have respiratory distress, things like that. So sign of respiratory distress is nasal flaring. So if their nose is doing like this and they're gasping, or chest retraction, which you'll see right in this area where the ribs are, if they try to, like they're trying to get a breath, that's respiratory distress. Normal breathing in a newborn though is 40 to 80 breaths per minute. That's really pretty fast comparatively to an adult. So if they are doing that 40 to 80 breaths per minute, that's normal, as long as their lips and face are not turning purple or blue, and have those other signs of respiratory distress. The best way to warm a baby up is skin to skin contact. So if you feel like they're having any of those symptoms, get them up underneath your shirt, get them skin to skin, preferably with the mom. If not, anybody skin to skin, that's gonna raise their temperature the fastest and get them wrapped up. That's better than putting them in multiple layers. And whatever you're comfortable with at home, clothing wise, then they probably only need like one more additional layer. So if you're wearing a t-shirt and pants or whatever, and the baby's wearing the same thing, maybe a light blanket over them should be okay. To establish, I'm trying to run through this fast because I know I'm at 10 minutes. To establish the best milk supply, you're going to want to nurse the baby as often as you can. So probably at a minimum every 2 hours. If they're trying to take a long stretch of, 3 to 5 hours of sleep, you definitely want to wake them up and try to nurse them. This will help the milk come in faster. And that usually happens around day 2 to 5. So you definitely want to nurse often, and let them stay latched as long as you want, or as long as they will. And then a deep latch shouldn't hurt. It should be, or a good latch shouldn't hurt. It should be deep and it should not be pinchy. So if you need help with that, let someone know. Your baby may have like a yellow tint to their skin a little bit. A little bit of physiological jaundice is somewhat normal, and we'll come back out in 24 to 48 hours and assess the baby. And then we encourage a newborn exam at a pediatrician within the first week of life. But you don't want their skin to get too yellow, so take a good look at them every day in the sunlight, like in the window. And if you start noticing that, you can strip the baby down, make sure they're warm, and get them a little bit of sun therapy. You're going to get direct sunlight from a window, 15 to 30 minutes a day. The umbilical cord clamp, we will take that off 24 to 48 hours after the baby's born. You just keep that clean, dry, and it should fall off in about a week. And you're going to want to do like a sponge bath before then if the baby needs it. The main concerns for the baby is keeping the baby warm, but not a temperature. So a temperature would be anything over 100.4. Anything fewer than 30 breaths per minute or more than 80 breaths per minute. Grunting with nasal flaring, chest retraction, those are signs of respiratory distress. No stool or urination within 24 hours. That's a warning sign. Excessive sleepiness, like more than 6 hours, you're definitely going to want to figure out why that baby's being so lethargic. Extreme irritability or unable to console, jaundice, and poor latch. Those are all things that are major concerns. And of course, we stay on call for up to the next week, and then we are still available for you, phone support, and we will be doing the postpartum visits. So please reach out if there's any questions, if you need any assistance, and we will help to the best of our ability. Thanks.